December for 2022. Over to Somasundaram for his talk on teleconsultation for pediatricians, which is the way forward. Somasundaram, you can start.
Thank you, madam. Thank you for your nice introduction, and thank you IAP Chennai City Branch Organizing Committee and Office Bearers for including this topic, because way back during the first wave and second wave, I have given this talk in over 15 branches of IAP over the country, and now because of this threatening third wave, I believe this will also be useful for pediatricians who should be practicing. So gone are the days when when people have to wait in the doctor's clinic in a queue, like wanting to see your Balaji Darshan at Tirupati. Now doctor is on a call, so you can call the doctor, and it is legally, you can collect a fee for the call as per the Government of India guidelines, which came in 2020. So this talk will be useful for those who have already started the clinic practice after the COVID, who wanted to start teleconsultation also to add a butter and jam to their bread. Or it will also be useful who have still not started their practice, worried about getting a COVID, worried about using the hi-fi apps, and they want to use their own mobile phones as a platform for the teleconsultation. So is there a need for teleconsultation in the current scenario? Yes, we doctors are not invincible. Our syringes and our vaccines are not going to prevent us from getting the virus, because we still have heard that many people who have been vaccinated are still in the ICU. So the real achievement for the doctor at the end of this COVID era will be to have a no financial deficit, at the same time not having a COVID infection, because we all are having a lot of EMIs on our head. So the balance between should be the life and the livelihood, which can be only livelihood for us is our practice, which we have learned for the past 20 years in various medical colleges. So the question arises, is it legal in India to practice and get a fee for the teleconsultation? And what are the legal implications behind that? Yes, Government of India is very swift enough to come up with the telemedicine guidelines immediately 3 days after the lockdown, that physical assessment and physical consultation, though desirable, is not mandatory, and telemedicine is now legal. Doctors can consult, message, prescribe on phone. All are possible and all are advisable and all are legal also. So the guideline for teleconsultation was announced in the Gazette of India on May 14, 2020, after 45 days after the announcement. And now the legal protection to doctors was under the Section 4 of the Epidemic Act 1896. Has the teleconsultation gained momentum in India after the Government of India notification? Yes. So this is the report in June 30, 2020, hardly two months after the notification. 500% rise in healthcare teleconsultation in India. And it is very surprising to know that the 80% are first-time users and they have not done the teleconsultation before. And surprising to know that 70% patients do teleconsultation with known doctors only, because they want to see the same Swami whom they have seen before and not to see the new Swami. So the telemedicine market will see a big boom in India, and it will reach the $5.5 billion by 2025, which is a study which says. So can I also do teleconsultation? Yes. What are the methods which I can do a teleconsultation? I can do consultation on my mobile. I can do consultation on my email. I can do consultation on my various apps which are available. So you can do a video consultation on various chat platforms, various apps which have come up now. You can do a video consultation over Skype, WhatsApp video, FaceTime, whatever mode you have, you can do a video consultation with the patient. If the patient and you have the video platform, you can do an audio consultation over the phone, over the WhatsApp call, or various apps which give an audio consultation platform. Even a text-based consultation is eligible as a teleconsultation. A asynchronous consultation, the patient will mail you all the reports or fax you all the reports or do a recorded voice over to you. You at your free time can see the reports and send the report to the patient, and you can collect your fee. So these are the various methods, and everyone has got its advantages and disadvantages. Now the question arises, should I get a consent before I do a teleconsultation? Consent is the key, but what guidelines say is, if the patient has sent you a message that I want a teleconsultation, that itself means that the consent is implied from the patient, and you need not have another consent from the patient. Fee for teleconsultation. Yes. What government of guidelines say, Gazette says, telemedicine consultation should be treated the same way as in-person consultation in a fee perspective. And you can also give a receipt and invoice for the fee charge for providing a telemedicine consultation. So you are at the liberty to charge the fee, whatever you are charging in your OPD, or more than the OPD or less than the OPD. There may be few queries in your mind, like our friend Vivek calling Mathrubudham in the midnight, asking, are you Labagdas or Lord Labagdas? Can I attend such types of calls, or should I neglect such types of calls? The RMP can choose either to attend the call or not. The RMP can also choose not to provide the consultation to the patient if it is not during the duty hours. You are not bound legally. In case I feel the patient requires a physical examination, how do I ensure that? The RMP has the right. The patient has come over now. The patient, you feel that the child is very dehydrated. The child is not fit for teleconsultation. At that time, you can stop the teleconsultation. You can ask the child to come for a physical consultation. Or if you feel that the patient is rude to you, or patient is not having good words with you, you can refuse or discontinue the teleconsultation at the same time. At the same time, the patient also has the liberty to stop the teleconsultation if he is not comfortable with you. If it is an emergency situation, how can I handle the teleconsultation? You need not be panicky. You can advise what is the first aid for this condition. You can counsel the parent. For example, if it is a simple febrile fit, the patient has called you in an emergency. What should I do? You can advise the first aid. You can counsel. You can facilitate them. Where is the first referral center near their place? So I am doing teleconsultation for the past 15 or 16 months since last July, but I'm not using the apps at all. I'm using my own mobile phone as a teleconsult platform. And my first initial steps will be the patient will be calling the appointment number. Either if I'm in my clinic, the staff will say whether you are willing to come to my clinic or you want to do a teleconsultation. If the patient says, I want a phone consultation, then the patient will be asked to send all these details: the name of the patient, the date of birth, the weight last check, the problem, what is the problem, and what is the contact number of the patient. So this is the snapshot what my sister will be sending to the mobile phone of the patient: the name of the child, date of birth, weight, problem, contact number. And they wanted to also say what charge for audio consultation and video consultation, and what number they should send the screenshot. And this is the thing which the patient has sent to the appointment number: need an online consultation, the name of the child, contact number, and everything. And this will reach me. So the sister will forward this to me, and obviously the fee has to be paid through one of the payment gateways. The number will be shared with the patient, and the patient has to pay the fee. And now it's my turn to call the patient from my WhatsApp business number. I will call the patient in detail. I will note down the details. I will register the patient as an online patient number, and I will consult the patient over the phone. If it is an audio, it is an audio consult. If it is a video consult, the patient will be called on a video consultation. So 3 things only are needed: an appointment phone, a smartphone with an Google Pay, Paytm, and a WhatsApp business, and a prescription pad. This is the way I write the prescription. I take a photograph and send it to the WhatsApp number of the patient. So teleconsultation. So this is the latest teleconsultation which I've done on Friday. So this is the registration number. So the past 16 months, I have hardly used a few platforms. Only 100 consultations are through the platforms, and 1,690 consultations I have done through my own platform, which is the WhatsApp. But everything will have a few pros and cons. So the basic advantage for the doctor: monetary benefit, because that is the livelihood for the doctor. You will get money. And the second advantage is you will hold your own patients. The patients won't go anywhere searching for another doctor. For the patient, consult the routine doctor itself. The same Swami can be darshaned at the ease from the home. They need not travel long searching for a Ola or a Uber. Safety is the primary concern. The pro is the safety. The patient safety is also ensured. If the patient is a COVID patient, the health worker safety is also ensured. Maintenance of the record. Since everything is as a snapshot of the prescription, you have a maintain of the record, and the patient will also have a record that is a legal protection. Cost factor. The cost factor is also there in the travel. The time factor is also there in the travel. They need not wait for their husband to come back, take the child to the doctor. Faster access to the services. Immediately they can access the services of you. Stick on to the appointment timings. They need not take the appointment at 2 o'clock and come to your 3 o'clock. At 3 o'clock to your clinic. At 2 o'clock is the appointment. You can directly call your patient. Equal access to quality healthcare. Even a patient in Kalakurchi can call Dr. Vishwanathan and Apollo Children's Hospital and take a gastroenterology appointment. Reduce the burden on hospitals because minor complaints are treated on the mobile phone. They need not go to the other hospital and burden them like going to the tertiary care like hospitals like Child Trust, when we people are there to give a teleconsultation for minor problems. But there will be some other demerits also. One is the time delay. If you are busy in the OPD and if there is a time delay in consulting, and if it is an emergency, the patient will get irritated. Important thing is the physical signs like dehydration, shock, and abdominal tenderness may be missed when you are doing a teleconsultation in a child. Securing an admission, you have done a teleconsultation for the 5 days of fever. If the 6th, 7th day, if you want to secure an admission and you are not in the practice, it will be very difficult for the patients. Grievance arises from interstate teleconsultation because I have even patients from Bhopal and Manipur calling me for teleconsultation. Legal jurisdiction, where will they sue me? Which court of law they will sue me? They are not clarified in the teleconsultation procedures. Insurance cover for a teleconsultation, that is not clearly defined. Not all drugs can be prescribed in the teleconsultation because of want of time. I have not shown those drugs which are eligible to be prescribed over a teleconsultation and those things. Data leak of patient records, very, very important. If you are using these 153 apps which have come into the market, there is a chance of data leak of the patient. Recordings of the conversation. Most apps are recording your conversation between you and the patient, and they can be used for various purposes. Pharmacy, honoring of e-prescription is not available in many pharmacy, and the availability of the medicine which you prescribe may not be available in their pharmacies. Enable the software platform companies which we use can start giving ratings for the consultant also. That is also one of the disadvantages of this teleconsultation. Probably you will be the right person to weigh the pros and cons of this teleconsultation, and it is never too late for a new beginning in your life. Today is the best day. If you have not started these services, please start the services. It will be useful for you and also to your patient. Thank you, Helios, for keeping this COVID at check for the past 16 months. Thank you.
Sundaram, that was an excellent talk and very, very precise, and whatever was needed was stressed. I think it was a wonderful talk. And I think I will conclude the session by saying that as healthcare workers, let us not relax that COVID has gone away. It is still there very much around us. And I think we have to follow protocols and as much as possible, try to do teleconsultation like what Somasundaram mentioned. And I thank all the panelists for a wonderful session. I hand over the mic to Dr. Dakshayani.
Thank you, ma'am. I thank the chairperson, Dr. Janani, madam, and the speakers of this session for a very neat, clear, and crisp session. I now request our Vice President South Zone, Dr. Somashekar sir, to chair the next session and conduct the proceedings. Over to you, sir. Sir, over to Dr. Somashekar sir, our Vice President.
Thank you, Dr. Dakshayani, for having invited me to chair this session. I'm sorry, I may intervene some technical glitches as I have joined from a mobile. I'm right now receiving a baby in a theater. But today, I think it is a very happiest day that for me, which started in the year 2018.